Hello, everybody, and welcome back to our How To Corner. In today's episode, we're going to talk about the lateral epicondylitis, which we know as tennis elbow. Before we get started, please like, share, subscribe, comment, ask questions in the comments, and we will definitely address those questions if you have anything you want us to talk about specifically. And I'm Will Gray, your friendly neighborhood DPT. So let's get going. The agenda for today's episode is what is it, basically lateral epicondylitis, causes and risk factors, signs and symptoms, diagnosis, treatment options, recovery timeline, return to activity, prevention, and strategies. And those things are some of the things we're going to cover in detail, and some we're going to have a little bit more brief presentation to them because this particular injury is something that happens a lot, and we want to try to make sure that we're able to cover it, but also give you some pretty much concise tips on how to prevent it. Now, what is tennis elbow? So basically, for us, is an overuse injury of the tendons of around your elbow, more specifically your extensor tendons, the tendons that are actually on the top of your hand, or what we like to call the dorsal aspect of your hand versus your palm, and that affects the outer part of your elbow, and it causes you to have these different types of symptoms, pain, weakness, and all that. Despite the name is only about 10% that are caused by tennis elbow, the reason not we, but the reason they named it that is just because of the nature of the injury, and most of it is an eccentric injury where you have a loading of the extensors of your arm, and as a result, you have this pain that pretty much comes about, and it's a repetitive deal. So basically, that overuse definition we used earlier, that micro trauma that occurs at that area around your elbow, it tends to cause inflammation to be persistent there, and then it leads to pain, discomfort, and weakness. Now, causes and risk factors, I kind of covered them some in the last slot. Repetitive wrist and arm motions, the sports you play, really any sport. I know we have tennis, racquetball, golf, and baseball, weightlifting listed here, but basketball also, as well as football, pretty much every sport you play, baseball, as well as softball. Any occupational risk, if you're a carpenter, painter, mechanic, or office worker, anybody who uses their hands quite often, and as a result, you have a symptom of weak forearm muscles that actually come into play with poor technique or just basically repetitive technique, and you don't have the strength of those muscles to basically build up some resilience. And so the breakdown after use is not something that you continue to experience pain with. These are the signs and symptoms. Pain and tenderness over that lateral outside aspect of your elbow. Pain worsens with gripping, lifting, and twisting. And as a result, you develop weak grip strength as well as stiffness in the elbow, especially in the morning. Now, in order to diagnose that injury of tennis elbow, physical examination, palpation, movement test. You press over the lateral aspect of your elbow or the outside part of your elbow. You should be pretty tender there, and if you are, you probably have some stage of tendonitis, which in this case is tennis elbow. And if you were to do a test where you flick the third metacarpal of someone's finger when they have their fingers extended, and if you flick it, you sometimes get a symptom or pain symptom from that. Images and x-rays can be used to rule out arthritis, but not always necessary. MRIs and ultrasounds can be used to assess the tendon damage. That's more for a chronic nature of the symptoms. I said chronic nature of the injury itself, just to make sure the tendon hasn't reached a place of tendinopathy where there's some type of procedure that needs to be done. But for the most part, these are not necessary unless there are extreme measures that need to be taken. Now, the treatment options. You have a conservative treatment management, and you also have the advanced. For the conservative situation, you're going to rest, have an activity modification, use ice, anti-inflammatories, bracing of the forearm with straps, and then stretching, strengthening, and exercises with your physical therapist, or just on your own to be able to have just somewhat of a home program. If those don't address it, believe it or not, people go as far as having injections, PRP and therapy also, and surgery, which is very, very rare. For, in my opinion, you want to get with a therapist that actually has an experience working with this very extensively in order to get you on the right program that's proper for you to address it. And just be honest with you, it's something that requires a lifestyle change because you will have to introduce some level of strengthening and consistency with your approach to strengthening in order to make sure that this particular issue does not arise again. Now, the recovery timeline depends, mild, moderate, and severe cases. If it's a mild situation, 6 to 8 weeks. Moderate cases, 3 to 6 months for the most part. Severe cases, it can range from 9 to 12 months due to after the surgical procedure. I know we have a split here. That's just more of an error on our behalf because the actual recovery in a surgical procedure is going to tie into your severe cases about 9 to 12 months. You have a lot of things that go across that area that you have to be aware of and be able to deal with during the surgical recovery piece. And so that severe case can cause you to have a neurological impact also that can limit your ability to return to what you're doing or basically cause you to have some persistent issues thereafter. Now, returning to activity, a gradual reintroduction of activity, emphasis on the correct technique with the sports that you're performing or the work activity that you're using, and also supportive equipment, braces, ergonomic tools, straps, maybe some compression garments, and then ongoing form strengthening and stretching. You have to have a program that you dive into and you stay with in order to make sure you maintain the symptom relief that you actually have gained from one of those treatments, conservative or the advanced treatments. And if you do that, you should be able to maintain some pain relief. Now, prevention strategies, proper warm up before sports or work start. Warm up in the sense of, stretching, doing some massaging of the area, maybe adding a heat pack to kind of get the blood flowing to it, and then making sure that you're doing correct technique with all of those particular activities you're trying to do. And then choosing the right equipment. Sometimes in tennis, the racket can be too big as far as the weight. It can also have a grip size issue in baseball and football. Also, your throwing mechanics, just making sure you're tying those together and maintaining that strength of your forearm and your wrist muscles to help prevent the breakdown that causes you to have that persistent pain due to the accumulation of trauma to that area. Take breaks from repetitive motions as needed, ergonomic adjustments at work to be able to adjust your keyboards and anything else that you're using at work in order to offset or offload some of that pressure on your actual forearm muscles in order for you to prevent that micro trauma that constantly leads you into that particular world of that inflammation or that itis, right? And then as a result of doing all that, you should be able to have a really good outcome. And if you have any questions, you can always reach out to us on all our platforms, like, comment, subscribe, email us. We have a contact page there in case you have some specific lingering issues that you want to get addressed. And with that being said, I hope you have a blessed one. I'll catch you in the next one.